Okay, so good question. So what do I eat after all that? Okay, so what was your question? Right, so you were asking about sort of what you could eat. So we spoke about sort of obviously the herbs, watercress, parsley, yeah, and you asked about kale.
Yes.
Kale is good, but it does contain a lot of oxalates which are designed for you not to digest it. So you have to sort of wilt it, yeah. So blanch it, wilt it before you eat it, yeah. But no, don't eat like huge quantities of it, okay. And then of course, what potatoes? Yeah, we spoke about potatoes. Potatoes are high in sort of soluble carbohydrate, but a good way to have them if you must have potatoes. I don't advocate potatoes. I think personally sweet potatoes are better because they're higher in fiber, higher in protein content. So sweet potatoes are better than ordinary white potatoes. There is a Japanese purple potato that you can get now, which is really high in protein and very high in insoluble carbohydrate. Okay, I don't know where you can get them from, but look for it. It's a Japanese potato. I think they are becoming much more available now, and they're higher in protein and lower in soluble carbohydrate. There is a trick that you can do with potatoes, but what you do is you cook them and then you put them in the fridge overnight. When you put them in the fridge overnight and then eat them the next day, warm them up, cook them whatever way you want to the next day, what tends to happen is that overnight sort of cooling in the fridge seems to sort of make the carbohydrate more insoluble, right? So it doesn't cause such a fast spike of glucose in your blood. So that is the way of sort of cheating with the potatoes, is you put them in the fridge overnight and then cook with them the next day. Once you've cooked them, so you have to cook them first and then put them in the fridge.
Okay.
Yes?
Yeah.
So that's the way of doing it. What other questions did you have about food?
There's something else we just forgot. Rice.
Yeah, rice. Rice is very soluble carbohydrate, especially the white rice. But actually, white rice can actually be better than the brown rice, because the brown rice, although you're going to get sort of a bit of a wheat bran, you're going to get a little bit more sort of minerals from the husk of the B vitamins in particular from the husk of the rice when they're brown rice. The problem with it is it can cause a little bit more digestive issues, and it can also again, we're talking about like in the almonds, that sort of shell of the skin of the rice is there to protect it. Right. So it's going to contain more chemicals in it. So white rice is actually not a bad thing to have, but don't have large quantities of it. And again, what you do with it is you cook it and you put it into the fridge and then use it the next day. Then again, it does what potatoes do, in the sense that you're creating a more insoluble carbohydrate, but not too much. We should never be having too much rice, right, and too much potatoes.
Okay.
Answer the question?
Yeah.
Great, fantastic. So, thank you very much.
Thank you.
Thank you, camera lady.
Yeah, absolutely. Didn't she do well? And there she is.